name is Vanessa. I'm going to be your nurse today. Can you tell me your name and your age? 5. Okay. You're in for an abdominal assessment today. If you have any questions, just let me know. I'm going to be palpating your abdomen, so I'm just going to be touching it and stuff. And if you feel any tenderness at all, just let me know. So first, we're going to start by inspecting. I'm going to get down at eye level. I'm looking at your contour, the shape of your abdomen. I'm looking for color, scars, striations. Your umbilicus is nice and midline. And I don't see any pulsations or visible peristalsis. Okay? So now, I'm going to go ahead and listen to your bowel sounds. Okay? So I'm just listening to different spots. Doesn't mean nothing's wrong. I just gotta listen. All right. So now I'm going to use the bell side of my stethoscope, which is the small side, and I'm going to listen to some vascular sounds. Okay. This is your aortic, renal, iliac crest, and femoral. All right. Did you feel any tenderness? Okay. So now I'm going to do some general percussions, okay? Now I'm going to do some light palpations, okay? Any tenderness? Okay, good. So now I'm going to go a little bit deeper, okay? Let me know if there's any tenderness, okay? Did you feel any there? No? Okay. So now we're going to check for some organ swelling, okay? And your arm is nice to the side. Perfect. So I'm going to first palpate your liver. I'm going to lift you up right here, under your ribs. Breathe. Good job. Good deep breath. Good. All right. I'm going to do spleen on the other side. Lift you up. Okay. Good. Did you feel any tenderness? Okay. Now I'm going to feel for your kidneys. Okay. That's good. All right. So now I'm going to do some specialty tests. I'm going to check for your gallbladder. It's going to be the Murphy's test. Take a big deep breath. Good job. Any tenderness? Okay. And then I'm going to be checking for your McBurney's point, okay? I'm going to push right here. Any tenderness? How about now when I let go? Pull back. No? Okay. So I'm going to check for your Bloomberg's test, okay? I'm going to push right here. Any tenderness? How about when I let go? No? Okay. So both of those check for appendicitis and for any kind of rebound pain, okay? So another test is called the iliopsoas. It also checks for appendicitis, okay? It's going to be on your legs. So lift your leg for me. Good job. Lift this one. Good job. Okay. Did you feel any pain or tenderness? Okay. So can you sit up for me and face that wall? Thank you. We're going to check the CVA tenderness, which is checking for your kidneys. Any pain? Tenderness? Okay. How about right here? No? Okay, excellent. You can turn around. And we're all done. Did you have any questions? No? Good job.
We report on a 5-year-old female who came in for an abdominal assessment. We started off with inspection at eye level. Abdomen was nice, flat. The color was appropriate. There was no striae or no scars. It was nice and symmetrical. The umbilicus was midline. And there was no physical pulsations or peristalsis. Then we moved on to the bowel sounds. They were present in all 4 quadrants. Vascular sounds noted at the aortic, the renal, the iliac crest, and the femoral with no thrills. And we assessed it with the bell. General percussion was done with resonance and timpanage heard. CVA tenderness was negative. There was negative to tenderness to light and deep palpation. And we're unable to palpate liver, spleen, or kidneys. And the patient denied any tenderness. Specialty tenderness test of the negative Murphy's, negative Bloomberg's, negative McBroom's point, and negative iliopsoas.